Understanding the ECG or EKG, an essential tool for heart health. The heart is a muscular organ at the heart of our survival, and its operation is precise, miraculous, and vital. Each heartbeat is the result of a well-coordinated electrical system that ensures that blood flows efficiently throughout the body. When this complex system goes awry, the consequences can be severe. That's where the electrocardiogram ECG or EKG comes into play. It is a diagnostic tool that has become indispensable in modern medicine to assess heart health, diagnose disease, and monitor the effectiveness of treatment. Why do we need an ECG? An ECG is more than just another routine test. It is a window into the electrical activity of the heart. A variety of clinical situations may require an ECG, each of which highlights its importance in detecting and managing cardiovascular disease. The main reasons for performing an ECG are diagnostic accuracy, monitoring heart function, evaluating the effectiveness of treatment, and performing preoperative evaluations. One of the most important reasons for performing an ECG is to accurately diagnose heart problems. The heart's electrical system is responsible for the rhythm and rate of the heartbeat, and sometimes malfunctions, resulting in abnormalities that can be detected by an ECG. This test can reveal a variety of heart conditions, from mild to severe. For example, arrhythmias, or irregular heartbeats, can be life-threatening if not diagnosed and treated promptly. If left uncontrolled, arrhythmias can lead to complications such as stroke or heart failure. By mapping the heart's electrical activity, an EKG can detect these irregular rhythms and help guide treatment. For patients who present with chest pain, an EKG is often the first diagnostic tool used. It helps differentiate between a heart attack, myocardial infarction, and other causes of chest pain, such as gastroesophageal reflux or musculoskeletal pain. A heart attack causes specific changes in the heart's electrical patterns that can be detected on an EKG, allowing for timely intervention and life-saving measures. Monitoring heart health is another important reason to get regular EKGs. This is especially important for people with known risk factors for heart disease, such as high blood pressure, diabetes, high cholesterol, or a family history of cardiovascular disease. Regular EKGs can help detect early signs of heart disease before symptoms develop, allowing for early intervention and management. For example, people with high blood pressure are at risk for left ventricular hypertrophy, a condition in which the left ventricle of the heart thickens due to increased workload. This condition can lead to heart failure if not properly managed. An EKG can detect early signs of hypertrophy, prompting further testing and treatment to prevent complications. Likewise, people with diabetes are at higher risk for coronary artery disease, even if they don't experience classic symptoms like chest pain. An EKG can detect silent ischemia, a condition in which the heart muscle doesn't get enough oxygen due to blocked arteries, even when there are no symptoms. Early detection through regular EKGs can lead to lifestyle changes and treatment that can reduce the risk of heart attack and other complications. Once a heart condition is diagnosed, treatment is started to manage the condition and prevent complications. Whether the treatment is medication, lifestyle changes, or a surgical procedure such as a pacemaker implant, it is critical to monitor its effectiveness. This is where serial ECGs come into play. Before undergoing surgery, especially major or elective surgery, a thorough evaluation of heart health is essential. ECGs are often included in preoperative evaluations to ensure that the patient's heart can withstand the stress of surgery and anesthesia. This is especially important for individuals with known heart disease or risk factors. What conditions can an EKG detect? The EKG's ability to detect a wide range of heart conditions makes it an indispensable tool in cardiology. While it is a relatively simple test, its impact can be far-reaching, helping to diagnose conditions that may otherwise go unnoticed until they cause serious harm. Here are some of the main diseases and conditions that an EKG can help detect. 1. Arrhythmias, irregular heartbeats. The arrhythmias are one of the most common conditions detected by an EKG. These arrhythmias can range from benign to life-threatening. An EKG can differentiate between different types of arrhythmias, such as atrial fibrillation, ventricular tachycardia, and bradycardia, each of which requires different treatments. For example, atrial fibrillation is a common arrhythmia that increases the risk of stroke. This condition occurs when the upper chambers of the heart beat irregularly, resulting in poor blood flow. An EKG can detect the irregular rhythm characteristic of atrial fibrillation, prompting further testing and treatment to prevent stroke and other complications. On the other hand, ventricular tachycardia is a more serious condition in which the lower chambers of the heart beat too quickly, reducing the heart's ability to pump blood effectively. If left untreated, it can lead to cardiac arrest. An EKG is essential in diagnosing this condition, allowing for quick intervention to prevent potentially fatal consequences. 2. Heart attack. One of the most important uses of an EKG is in diagnosing a heart attack. During a heart attack, blood flow to part of the heart muscle is blocked, causing tissue damage or death. This damage changes the heart's electrical activity, which is reflected in specific changes on the EKG. 3. Coronary artery disease, detecting blockages. The coronary artery disease occurs when the arteries that supply blood to the heart muscle become narrowed or blocked due to plaque buildup. If left untreated, this disease can lead to angina, heart attack, or even heart failure. An EKG can help detect signs of CAD by showing changes in the heart's electrical activity when blood flow is reduced. 4. Heart enlargement, assessing heart size. Hypertrophy is a thickening of the heart muscle, usually caused by increased workload or stress. This can occur in conditions such as high blood pressure or heart valve disease. An EKG can detect signs of hypertrophy, which is important in managing the underlying cause and preventing complications such as heart failure.